7AD, 7BU, it is Health Matters. Colin Wood now from Ulverstone's Fullife Pharmacy. Just look for the purple pharmacy. Firstly, good morning to you, Colin.
Good morning to you, Lee.
Now, this week we were going to talk about irritable bowel syndrome. We'll leave that to another week. And with the development of the health scare caused by the contamination of a recall of Nana's frozen berry products, I guess it's a good opportunity to have a look at hepatitis and what it means for our community. Most people hear hepatitis and think, oh no, that's pretty serious stuff. Is that the case?
Well, to a degree that can be the case, but there's a whole heap of different types of hepatitis and they have a range of causes and symptoms. The term hepatitis itself is fairly easily broken down. The first part, hepa, means something to do with the liver, and then itis on the end means inflammation, which is pain or swelling. So hepatitis is actually just inflammation of the liver. The liver is important for a whole range of different functions within the body. It's used for regulating metabolism and making proteins, storing vitamins and things, and also removing a lot of the toxins from our bloodstream and producing bile, which helps with the digestive process. So if your liver's not working properly, then it can cause illness and sometimes even death.
Is it normally through frozen berries, or are there other causes how we get hepatitis?
Well, there's a whole heap of different causes as well. Infection and viruses is certainly one, but exposure to different chemicals, drinking too much alcohol, drug use, and there's some other factors as well that can cause hepatitis or inflammation of the liver. The various forms of viral hepatitis are named, and we're familiar with those, A, B through to E, and they're quite often just called Hep A or Hep B, Hep C, and so on, and things like that. But when the viruses affect the liver, they can be spread in different ways and different treatments. But in Australia, the most common ones are Hep A, B and C.
So this outbreak involves Hep A. What can you tell us about this type of hepatitis?
Well, yes, it is one that is caused by a virus, and I guess anyone can be infected with hepatitis A if they've come in contact with food or drinks or that have been contaminated by people who haven't perhaps used the right sanitation procedures, and they may have some excrement on their hand or things like that. It's essentially transferred through human excrement. And outbreaks have been associated also with people eating contaminated shellfish or injecting illegal drugs and a few other things. But they're more common, I guess, in countries where the standards of hygiene are quite poor.
Colin, why has this outbreak occurred?
Well, it's sort of related to that. From the reports we're hearing, it appears that the berries that have been imported may have been prepared in some facilities that don't actually have good enough hygiene standards, and they've become contaminated through people who perhaps haven't washed their hands. It's a bit hard to know for sure, but it's something along those lines. I guess, unfortunately, they're frozen berries. You think perhaps they'd be okay, but freezing and even cooking, for that matter, don't actually affect the hepatitis virus. So even though they've been frozen or cooked, the virus can still be there.
If we've eaten contaminated berries, say, for example, will we be contracting hepatitis A?
Probably not, actually. There's only a small number of people who, when they're exposed to the virus, actually catch hepatitis A. However, the virus can actually incubate for up to 7 weeks from when you are exposed to it to when you actually start to show symptoms. So, you may be 2 months before you actually realise that you've got it. There's been some concern, particularly in some schools and childcare centres in Western Australia and Adelaide, where younger children may have contracted hepatitis A, and the symptoms don't actually come out in young kids, especially kids under the age of 5. So, the people working with them may be exposed to it, and they may contract hepatitis A. So, it can be a problem in those areas where small children are involved.
And what symptoms are we looking for?
Well, you can call it for pretty much any time between 2 and 7 weeks after you've been actually caught the hepatitis A virus, and the average incubation period is about 4 weeks, and many infected people, though, they don't actually show any symptoms, which, isn't such a big problem. But if you do get symptoms, it'll be generally fever, so higher temperature. You'll feel nauseous and perhaps vomit a bit. There'll be some abdominal discomfort. Your urine will actually go a darker colour, and your skin goes a yellow, and your eyes go yellow. It's just signs of jaundice, which is a disease of the liver, or an indication that your liver is not working properly. And these symptoms can perhaps last for several weeks, but quite often with hepatitis A, you do actually make a full recovery. And the good news, I guess, if there is good news, is that once you're infected, you are actually immune from hepatitis A after you recover. So, you won't catch it again later in life.
And how do we treat these symptoms? I'm thinking there's no specific treatment for hepatitis A?
Well, no, it's really just treatment of the symptoms. Most cases, with most people, unless your immune system is particularly compromised, your immune system can take care of the symptoms and will actually get you back to health albeit in, after a few weeks of feeling unwell. But I guess rest is probably the main thing, as it is with most recovering from most viral type diseases and illnesses. You'll have less energy for a while, so getting your rest and making sure you stay well rested is good. Eating smaller meals can help as well, because I mentioned before the nausea and the abdominal discomfort. Keeping the meals small actually helps you to digest it, puts less pressure on your liver to have to process a lot of food at once. So that can help it to recover more quickly, and really just look after your liver. Alcohol is one thing that is, puts pressure on your liver, so steering clear of that. And some people's medication also is processed by the liver, so your doctor may need to modify some of your medication if you're on regular stuff to make sure that your liver isn't put under too much pressure.
If anyone is worried that they may have eaten some of the recalled berries, what should they do?
I guess firstly, if you had a hepatitis A vaccine, if you travelled overseas and had vaccinations before you go, if you had that vaccination, then you'll probably be immune and it won't be a problem for you. If you've eaten the berries but you haven't actually seen any signs of illness, I guess the thing is to be watchful to make sure that you don't none of the symptoms develop. And I guess if there's no symptoms, then you don't really need to be tested. Certainly, if there's symptoms, you go straight to your doctor. They'll do a blood test to check for Hep A and then take it from there. But unless you're really showing the symptoms, there's probably not a need to do that unless you just want peace of mind. If you have been exposed to them, it's a good idea to make sort of up your hygiene practices for a little while, washing hands, especially after you've been to the toilet and those sorts of things, to reduce the risk of passing it on to someone else if you do actually have the vaccine, but have the virus without actually showing any symptoms. So, cleaning your bathroom and toilet and things like that, making sure cleanliness is high on your agenda is a good way is something that you should do if you think you might be exposed. I guess a person who does have hepatitis A is infectious from the 2 weeks before that they actually start showing symptoms till a week after the symptoms actually develop. So there's a 3-week period there where you're actually contagious. I guess if you want to be protected, you can have a hepatitis A vaccine, and that's basically, if it's just hepatitis A by itself, it's a 2-injection course where you have one and then another one in 6 months' time. Or if it's hepatitis A and hepatitis B, which is sometimes linked together, it's a 3-vaccine course. The second one a month after the first, and then another one at 6 months.
And if you've got any questions, of course, you can wander into your Fullife Pharmacy in Ulverstone. You've got a web page there, or you can leave a message on our Facebook page too, through bestmix.com.au.
Absolutely, Lee. We're happy to help anyone we can.
And we might chat about irritable bowel syndrome in 7 days' time.
Yep, that sounds good, okay.
Colin Wood from Ulverstone's Fullife Pharmacy for Health Matters, 7AD, 7BU.
Thanks.